Hello, everybody. I'm Jennifer Hill, and I'm with the Huron Valley Chamber of Commerce, and I want to welcome Stacy Wack from Benessere Wellness Center, and she is going to tell us an alternative way to get our health care, and I think it's really important to understand that there's other alternatives out there, especially during this time. So take it away, Stacy.
Thanks, Jen, and I want to thank the Huron Valley Chamber for asking us to host this lunchtime seminar. My name is Stacy Wack. I am the owner and provider of Benessere Wellness Center in Milford, and also the owner of Vita IV Hydration and our new body spa at Benessere. So we've got some great things happening here at Benessere that we can't wait to share with the community and the small businesses. We're doing some pretty exciting things here, and check us out on Facebook. We'll be making some announcements coming here soon. The reason we joined today to talk about our business model was really to show that there's other options out there for not only individuals, but for small businesses, because sometimes you think about trying to provide benefits to your employees and the cost can seem exorbitant and prohibitive to providing benefits for employees. And right now, when it's hard to find good help and hard to retain good help, this is, can be a really huge benefit for businesses. So we are a direct primary care office, and I guess the first thing to do would be to explain kind of what direct primary care is. And that is, it's a subscription or membership-based model for healthcare. And it's as opposed to your traditional insurance-based model that most people are pretty familiar with. That's where you go to the doctor, you show them your insurance card, pay your copay, you have to pay your deductible, you're paying your monthly premium. We tried to make it simple because one of the things we found that when people are in that traditional insurance-based model is that the care suffers. Patients wait for sometimes weeks to get an appointment. You show up to your appointment, you'll wait for 1, maybe 2 hours before the doctor or provider even comes in to see you. And then you get all of 10 minutes of FaceTime, if you're lucky, because they're sitting there usually behind a computer screen, typing their notes away so that they make sure that the insurance is going to pay them for their visit. And there's all these hoops that they have to jump through and all the boxes that they have to check. And if even one of them isn't done, the insurance will find a reason to not pay that bill. So you'll see that it almost kind of looks like an assembly line going through the doctor's office. One patient in, one patient, next patient, next patient, next patient, and they're just running from patient to patient. So you really can't have that good, close relationship with your doctor and your provider when you're in that assembly line, model of care. So what we've done is we've kind of taken a step back. We've tried to slow things down, have less patients, and provide more personal time and attention to those patients so that we can really get to know them, know their concerns, and work together for a solution to their health problems. So what we've done is we said, okay, we're going to limit our practice to 500 to 800 patients versus the traditional office. You may see 4,000 to 5,000 patients for that one doctor. So, if we've taken about 10% of the patients is our maximum, how much more time can we dedicate to those patients that have decided to join our practice? So all of our visits are unhurried. We spend as much time as needed. I've had office visits go as long as 2 hours if needed. And we really, sit and discuss the problems, discuss the issues, come up with solutions and work together. And you can come in and see me as often as you need to get that problem resolved. And we do all of this for a monthly membership fee. And we've kind of recently changed our model a little bit, whereas before we kind of had like a one size fits all and it was based on your age. We decided to take a step back based on some feedback we had gotten and really try to customize it to the need of the patient. So if I have somebody who says, I really don't go to the doctor that often and I don't see how I need something like this. Well, everybody, no matter who you are, should get a physical at least once a year because problems are easier to correct when they're first diagnosed. If you let them go for years and years, then it's a lot more work to get things back on track. So regardless, everybody should get a physical. So we have packages that start at $25 a month that includes unlimited healthcare virtually, and then there's a small office fee for office visits if you're on that particular level. And it goes up to $100 a month. And as you take, those steps up in the package, you get more things included. I would say the average person is on our $50 per month plan, and that allows for unlimited office visits, unlimited virtual visits. We give discounts on our aesthetics and our IV services. There's we do home visits as well, which most people don't realize. So in the time of COVID that we're in right now, that's a great thing to take advantage of, because that prevents those people who may be afraid to go out. We can come to you and address your health concerns there at home in the comfort of your own home. So why do we feel that this is a better model, not only for patients, but for businesses? Because we feel not only do you get the personal attention and care, but you also are going to get reduced costs of your healthcare. We find that we can save patients money on their labs, on any imaging studies they need, on their prescription drugs, on their overall annual healthcare costs, because we encourage people to combine our services with a lower cost, high deductible insurance program, which is what most people are on anyway, but you might be able to even take a step down and increase your deductible and reduce your monthly premium. That will help to generate savings in the hundreds, if not thousands of dollars annually. I have a patient who actually told me that her family was spending something like $2,200 a month to cover 2 pretty healthy adults and 2, young adult children. And in order for the insurance to pay anything, they had to meet like $40,000 with deductibles and all that stuff. So before the insurance paid $1, they were spending close to $40,000 a year. And to me, that's just absurd. If you put that $40,000 into a savings account or a money market account that's making a little money for you, you're going to end up being able to pay for all of your healthcare on your own and still come out ahead, because there's a lot of discounts that people don't realize when you pay for your healthcare yourself, when you pay cash at the time of service. Places it doesn't cost them anything to collect that money. They don't have to go through a biller. They don't have to go through a third party person. So it saves them a lot of money, and they in turn pass those savings on to the patient as the end user. So when we turn to looking at small businesses and the cost prohibitiveness of providing insurance for those small businesses, we feel that this is a great option that people don't even realize exists out there. We offer, your traditional monthly care, your physicals, but we also can handle like work injuries. We can act as an urgent care. If somebody cuts themselves on the job, they can be sent to us and we can take care of providing stitches or whatever's needed. If, they slip and fall, we could arrange for imaging for them. So we really try to encompass a lot of the things that a business is going to need more so than even just that individual, because a business has kind of unique needs. The other thing that businesses have, they really want to keep their employees healthy, because then that leads to less, reduced missed work. Healthy employees are happy employees, and it just brings a better kind of feel and morale to the workplace when they know that not only are they getting a paycheck, but they're getting benefits for their health at their employer, which is why companies like to do things for their employees. But we understand that, especially right now when companies are struggling because of COVID, that they're looking for ways to cut costs, and they're looking for ways to kind of just even stay afloat right now. And this will be helpful. So direct primary care helps to cut out kind of that middleman, which is the insurance company. With an employee program, we have a $50 a month program for employers as well. So if you think about, however many employees are in the business times $50 a month, that's going to be your monthly cost for healthcare. And we can do it on a monthly or yearly contract. And in the current model, the insurance-based fee-for-service model, doctors don't answer to their patients for the costs of an office visit or for the costs that are out there. They have to jack up their pricing so that they can actually make money doing this, so that the insurance, because by the time the insurance comes in with their discounts, the doctor's not making a whole lot at the end of the day. That's why they have to see so many patients. But with direct primary care, we have that one-on-one relationship with our employers, but also with our patients, and we are accountable to them for the costs of the healthcare. So we try to make it simple, one fee, unlimited care. In the employer model, there's no office visits, there's no, nickel and diming, everything is included for that. All of the patients have 24/7 access to the provider, which is myself, 365 days a year. It doesn't matter if it's Christmas, it doesn't matter if it's a Saturday. They all have my cell phone number. They, as an employer, the employers have my cell phone number. So if there is an issue with one of their employees, they can get a hold of me and we can get it resolved as soon as possible, get the employees back on their feet. So, our focus is truly on patient care. How often have you ever heard of a doctor handing out their cell phone number to the patient so they have that direct, line of communication? I won't say that it's never happened, but I would say that it's pretty rare. And because our emphasis really is on that, provider-patient relationship, we spend a lot of time with our patients. I would say 2 to 3 times what the average provider will spend. When we look at this particular model, it can lead to significant cost savings for the companies as well. Because, I have a statistic here that was talking about looking at a company that had 1,000 employees. Now, most of us in the chamber aren't going to be that size of a business. We're going to have, a few, tens, maybe a few hundred. But when they looked at this, it was a 10-year cost trajectory for this particular company that had 1,000 employees. And when they looked at 2010, their cost to provide benefits and annual health care to their employees was $5.6 million. Now, when they projected that all the way out to 2020, it was going to be $12 million for those same 1,000 employees. So a huge jump in a relatively short period of time. But by incorporating a direct primary care model, they found that they could actually save the company at the end of that 10-year trajectory. When they came into the picture at 2017, by 2020, that 10-year mark, they had saved them almost $4 million in healthcare costs to that company. So, by working directly hand in hand with a direct primary care facility, that's how we can directly influence and directly impact our business's bottom line. It's a way that we can help reduce employee hospitalizations because we're on top of the problem as soon as it occurs. We're reducing specialists being utilized because we're handling most things in-house. When you go to your primary care provider nowadays, they really have lost the ability because of time constraints to spend time working through your problem. Usually their answer is, here's your referral, go see the specialist. So now we're saying, nope, we want to take care of that in-house. We want to get to the bottom of the problem ourselves. And, there is a time and place for specialists and we definitely utilize them if needed, but we really don't that's not our first answer. That's not the go-to. So that's how another way, just reduce that utilization of specialists. We reduce the cost of from pharmacies because, we're looking for ways to get prescriptions at the lowest cost possible, even in-house if possible. We reduce all of the testing, unnecessary testing that can sometimes go along with not having the time to really understand the problem. And then we definitely, one of the biggest savings that we offer to employers, and when they're showing their insurance companies how much they're utilizing services, that's a direct impact on how much they pay annually for those contracts. Our biggest impact is when it comes to emergency room utilization and urgent care use. I encourage my patients to never go to the urgent care if I can, just because, I should know them. I know them better than anybody does. And the other thing is you don't always know what you're going to get in an urgent care. And because you have my cell phone number, there's not really a reason to go to urgent care because we can address those things right away. I try to really harness being the primary care practitioner for my patients. I don't want them going to the emergency room because they have an earache or a sore throat or something like that. Use the emergency room for true emergencies because that's what it's there for. So this helps to reduce the absenteeism of the employees, and at the end of the day, it definitely impacts the bottom line of the company. So I feel like with all of the things that we offer, we would love to put together customized plans for employers, because each company is unique and has its own needs. And I think when we work together hand in hand, we can look at how we can help save those employers money, give your employees better care, and just at the end of the day, a healthy employee is a happy employee. And who doesn't want to save money while being healthy at the same time? So we're just looking at managing, not only your annual physicals, but also managing chronic disease. I can't tell you how many times I've had people say, oh, I didn't realize you did that there. But yeah, if you have diabetes or high blood pressure or heart conditions, we can manage a lot of that stuff. But more beyond that, we also manage things like mental health, which is crucial right now. We're seeing a huge uptick in, people who are suffering from anxiety and depression and, being kind of stuck indoors and with limited resources for, activities outside of the home. It's really taken a toll on, adults, young people. And so we're seeing a lot of that here and, in the community. So we are an available resource to people for even their mental health issues. One little thing I would like to let people know too that we do is, I think an important thing for businesses is to make sure that your employees are healthy and not, if they have COVID symptoms, that they're getting testing in a timely manner. We do offer COVID testing at our facility. Even if you're not a patient, we offer that just as a service to the community. So employers can feel free to send their employees to us. We will offer them testing. We do not charge an office visit. We don't charge for our time to do that. We just feel that it's an important service to offer, and we want your employees to be back on the job just as much as you do. So we're trying to really kind of be there for the community, be there for the small businesses, be there for the families, to offer a better solution to healthcare at an affordable rate. And I thank you for your time today. I hope that I didn't take too much of it.
No, I think it's really important that our members understand the alternatives that are out there. I think I like that you work with insurance. What about like Medicare, Medicaid? Do you work with those as well?
So an important point to point out is that I don't bill any insurance out of my office. So I do not require patients to have any form of insurance, although I highly recommend and highly encourage them to have something, because you never know when something is going to go wrong. You need to have that ability to have hospitalization coverage, emergency coverage, surgical coverage. But that means I am inclusive of everyone that can be a patient of my practice here. And as far as Medicare goes, we don't bill Medicare, but we do have patients that have Medicare who then, just have to pay out of pocket for our monthly service. Same thing with Medicaid patients. We use their insurance for things outside of our office. If they need to see a specialist, if they need to have imaging done, if they need blood work, those kinds of things, that's where that comes into play. And that's whether it's Medicare, Medicaid, Blue Cross, doesn't matter. We utilize the insurance if it's appropriate and if it's going to be a true cost savings to the end user. I did have a patient tell me the other day that she went to pick up her prescriptions, and she's like, I can't believe it. The prescriptions, when I used the thing you suggested, were cheaper than paying cash than if I used my insurance. And I said, unfortunately, we see that pretty commonly. It's not a unique story. So, that's kind of where we get insurance involved when it makes sense. But, some of the times it really makes sense to just pay cash for it.
Oh, that's interesting. I know my mom and my brother have to pay. They just find, they're always finding out that the drugs that they need to take are costing more and more money. And it's just incredible. It just makes you, it's bad.
Yeah, it does.
Bad. I have another question. Tell us about your spa and your hydration. That's something new and different. I want to hear about it.
I'm super excited about this. This is my fun. I love taking care of people, and I think, kind of when we started Benessere Wellness Center, the vision was always there to incorporate kind of like that body, mind, soul. That's kind of what the 3 loops in the Benessere stand for. And you really can't feel good about yourself on the inside if you don't feel good about yourself on the outside.
Yeah.
So we have recently, we've been doing injectables for a little while, things like Botox and fillers and, Kybella, people are familiar with. But we just recently added our Diamond Glow facial machine to give a medical grade facial. We've brought in medical grade skincare lines. We're doing PRP for hair restoration for those men who are starting to, and women who are having thinning hair. We have microneedling. We have somebody on site who does microblading for the eyebrow loss. And so we're really just trying to bring together all of those things that make us feel good about ourselves, especially right now, because nothing makes us feel good. We can't go out to eat. We can't do a lot of these things. So it's, really giving people an opportunity to look good above the mask, kind of, so to speak.
Yeah.
And just really kind of do something for themselves when we've kind of been all just locked inside,
Well, I think that's exciting. I hope that you share all of your marketing materials with us so that we can pass that out along. I know a lot of people my age look for stuff like that.
We do. Yes, I know. And I'm right there with you. So, one of the things, and as we grow the spa, we have a lot of exciting ideas and things that we want to bring on. And we're looking forward to doing some of our pre-launch stuff and have some great specials and fabulous pricing. So we can't wait to share that with you.
That's exciting. Does anyone, Linda, I know you're the one, does anyone have any questions? I know you're eating lunch, Linda. Let's give her a second. I love the fact that you're offering these services for small businesses to enhance, because it's hard. I hear it all the time, trying to provide benefits to a small amount of people. It's very, very expensive. And this is a really great alternative.
Yeah. And we think that we can, at least have it be either a stepping stone to something or fill the gap. We have companies that combine our services with their insurance program because we fill that gap. We fill the gap of the patient, the only plan that they could afford for their employees was something with like a $5,000 deductible.
Right.
Those people are never going to use that insurance most likely unless there's something catastrophic because deductible is prohibitive. So what they do is they bring us on board, and for a very low cost per month, we're able to fill the gap between something catastrophic, because 90% of what you need is handled by primary care, and that's what we do.
That's awesome. I think it's a great model. Linda, did you have a question?
I actually do. I have a couple of questions. So first of all, I learned so much more about you today, Dr. Stacy. I want to thank you for one thing, for leading by example. You are proof positive that physicians can take a role in reducing the costs of medical care. And I'm just so proud to have you in my community doing this for us. And I'm sure, given what I've heard today, you probably have people from far and wide, from far outside of the Milford Highland area coming to see you. So I very much appreciate that. I wanted to know if you have heard anything, or if maybe you're planning at some point to offer COVID-19 vaccines, or if there's any plan that you're aware of right now for allowing private physicians' offices or clinics to distribute those. Not to distribute them, but to administer them.
Yes, actually, I did get an email, I want to say within the last couple of days, from the state regarding offering COVID vaccines, and I have to sign up to be eligible, which I do plan to do because I do know that it's something that, number one, there's a big demand for it in the community. People are having a hard time getting access to them, and it's a service that I definitely want to offer. So I am in the process of getting set up to offer COVID vaccines.
And is there any time frame that you're hearing right now as far as when that will happen?
It's really all up to the kind of the government and how they're distributing the vaccines. I know right now their focus is on, hospitals, health departments. They want to make sure that, kind of the front line, now the teachers and the senior citizens are getting vaccinated. So there's kind of a lot of a tight control on who gets it and when. But I know that there's a big push to get people ramped up. So I imagine it shouldn't be too long before we have them here.
Okay. Couple more questions. So are you affiliated with any hospitals right now?
Yes and no. So I have no direct affiliation as far as, admitting patients, but I do work with the hospitalists who really are the ones who manage inpatient care nowadays. Pretty much gone are the days where your primary care doctor goes and sees you and manages your care at the hospital. That has really been taken over by internal medicine hospitalist teams. So I definitely can coordinate that. If I have to send somebody to the ER, I try to call ahead and give them a heads up that this is the patient, this is why they're coming in, and let them know what I'm concerned about. I do work for a facility, St. Joe's in Ann Arbor, in addition to what I do here. Of course, I'm partial to that hospital system, but it does make it makes it convenient because if you have a hospital that you like, you're not limited by what hospital I specifically work for.
Okay, thank you.
Stacy, why don't you give us your website, and I will also link that when I post this. I'll probably have this up by the end of the week for sure, and I'll have it on Facebook, and I will also have it on our YouTube channel, and it will go out in the e-blast on Monday. So go ahead and tell us your website so that we can get that out there for people.
It's www.benesserefamilywellness.com, and Benessere is Benessere, and Benessere Family Wellness. And on there, you can kind of learn a little bit about our not only direct primary care, some of the aesthetic stuff that has, we haven't updated with the newest things that we're offering yet. We're in the process of doing that, but also about our IV hydration, which is a good thing to do if you're looking for an energy boost or something to kind of build up your immune system a little bit. We do offer immunity hydration therapies, and I would say 100% of the people and patients who have done the IV have said that it makes them feel amazing afterwards and really gives them a good boost to how they're feeling. So I would encourage you to check that out for sure.
So Stacy, let me ask you a real life question where that's concerned. Milford Memories is the week of August, say 14th, around that time. And the following week is my daughter's wedding. So, I'm just wondering if that's something that might make me feel better that day.
Well, a couple things as far as that goes. As far as Milford Memories, I have not had the privilege of attending due to COVID this past year.
Oh, yeah, we didn't have it either. Yeah,
I've heard stories, so I would encourage people that attend Milford Memories to think about a hangover relief IV. I've heard. So we do offer that, and then for you, for planning that wedding right after Milford Memories, I think you would definitely benefit from an energy boosting one to give you a little pep to get through all of that.
Maybe a little injection.
Well, hey, definitely. Not 2 weeks before any big event.
Okay, good to know. Good to know. Well, thank you so much, Stacy. Is there anything else you'd like to add before we close it out?
No, I just want to thank the chamber and thank the community of Milford for being very supportive from the time that we moved into the community. We've been here 3 years now, and we're growing by leaps and bounds, which is allowing us to do a lot of the fun things that we're doing now. And I'm actually sitting in the spa area of our suite. So you can kind of see, we try to create a very homey environment and comfortable. And that's how we approach everything. It's just to really make people at home and, not feel like they're in a sterile environment. So thanks for the support that you guys have provided to us. And we look forward to a long relationship with you guys.
That's fabulous. Well, I can attest to it is a homey environment. When we went for our coffee club, it was so lovely, and I'm sure your patients feel like it's your friends. That's what you want, right? A partnership. So thanks so much, Stacy. We really appreciate it.
Thank you. Have a great rest of your day.